arrived on scene, BSI. I'm wearing gloves to protect myself from bloodborne pathogens. I'm also wearing gloves not to contaminate any medication I may give to the patient. I also wear gloves so that any medication I administer via my hands through contact, I can't absorb that medication. I'm going to go around and look. The scene is safe. There are no additional bystanders to obtain a sample history. In my initial assessment, I have one male sitting in a chair in his home. He's in his late 20s to early 30s, a white male. He's complaining of chest pain. Good evening, sir. My name is Sean from the Keys Fire Department. How you doing this evening? The patient's chief complaint is he's complaining of chest pain. Sir, do you consent to treating you tonight? The patient consents. Sir, what is your name? The patient tells me his name. Sir, what time of day it is? Patient tells me it's the evening. Sir, do you know where you are right now? Patient tells me he is at his home. Sir, do you know who the president is? The patient answers. The patient is AO times 4. He is alert, he has a patent airway, and he is responding to my verbal commands. So I'm going to go ahead and get a sample history from you, find out if you have any diseases or any medications you may be taking. Through obtaining a sample history verbally with the patient has told me that he has a history of angina. He's also been diagnosed with coronary artery disease and has been prescribed nitroglycerin from his doctor. Through obtaining a sample history, I also asked when's the last time the patient has taken any of his medication, the nitroglycerin. The patient has told me that he last took a dose approximately a half an hour ago, and that he took it orally, chewed up the tablet, and swallowed it. The patient has told me on a scale from 1 to 10 of pain that his pain is a 9. I'm going to go ahead and take a set of baseline vitals. And once I've determined baseline vitals, I'm going to recommend that this patient is a high priority for transport. Now, sir, before we transport you, my recommendation is we go ahead and take another dose of your nitroglycerin. I want you to understand, sir, that nitroglycerin is a vasodilator. And what that means is a vasodilator dilates or opens your blood vessels. It prevents the muscles and veins in your arteries, the muscles in your veins and arteries from tightening and the walls of those veins and arteries from narrowing. Nitroglycerin, a vasodilator, allows blood to flow more easily through your heart. It also allows your heart to pump more easily. Nitroglycerin also lowers your blood pressure. So by taking a set of baseline vitals, I've determined that the minimum threshold for taking another dose of nitroglycerin is 110. The patient's vitals meet that threshold. The patient understands what exactly nitroglycerin does. Now, sir, I also want you to understand that the best method of administration of nitroglycerin is not orally via digesting it and chewing it. It's actually sublingually. Now, what that means is you're supposed to take the medication, put it under your tongue, and allow it to dissolve slowly. You're not supposed to chew it or swallow it. Do you understand? The patient does understand. Sir, before I administer another dose, I want to let you know about 6 patient rights. Your 6 patient rights are that you are the right patient. You've identified yourself, I've verified your identity, and I verified that you're the correct person on the prescription for your nitroglycerin. Your next right is the right medication. We verified that you are legally prescribed nitroglycerin from your physician, and we verified that the nitroglycerin that we're to administer to you is not expired and is the correct dose. Now, the third right is your dose, and we verified that we're going to give you a correct dose based on your prescription. The last 3 rights are route. Now, route means how do you administer it, sir? And I explained to you that you shouldn't eat it and digest it. You should take it sublingually. The last 2 rights are the right time and right documentation. And what that means is before we go ahead and administer another dose, we're going to record the time that you took it and any pertinent medical history and documentation of the effects of the medication that they have on you. Do you understand your rights? The patient understands his rights. Before I go ahead and administer another dose of nitroglycerin, I'm going to go ahead and call dispatch and get approval. I've called dispatch and they've given me approval. All right, sir, you're going to go ahead and take one more of these nitroglycerin. You're going to go ahead and put it under your tongue, not chew it, and let it dissolve slowly. Do you consent to taking this medication? The patient does. Go ahead and open your mouth, place the pill under your tongue, and allow it to dissolve slowly. At this point, I'm going to go ahead and reassess the patient's vitals. Because this is a high priority patient, we're going to go ahead and reassess the vitals every 5 minutes. As we're in the ambulance, en route to the hospital, we're going to continue monitoring those vitals and document any changes we may have. We are now in the ambulance. I've reassessed the vitals at the 5-minute mark. Sir, how are you feeling now? The patient tells me on a scale of 1 to 10 his pain has gone from a 9 to an 8. We're going to continue reassessing those vitals every 5 minutes and note any changes in conditions the patient may have.